Hello, this is Dr. Katrina Banks, neurologic physical therapist. Welcome to Neuro PT Now Education Series. Today, I'm going to answer the question, what is multiple sclerosis? And on top of that, we'll be talking about signs and symptoms, how is it diagnosed, statistics, and what causes MS. So MS is a disease that affects the central nervous system, which consists of the brain and the spinal cord. And with MS, your immune system attacks the central nervous system, eating away at the myelin sheaths and also eating away at the nerves that were wrapped under the myelin sheath, which becomes damaged, giving scars known as sclerosis. So therefore, it slows down the signals of messaging that is required to occur from brain to body. So with sclerosis, it's much harder for messages to be carried along that tell your body to move. So in this lovely picture, this is a normal nerve. And the yellow component is that myelin sheath that allows signals to bounce off. And in multiple sclerosis, that myelin sheath is eaten away, which means you have a very slowed responses occurring in your body that allow for movement. Neurons, let's talk about neurons, are cells within the nervous system that transfer information to other nerve cells, muscles, or gland cells. And neurons are made up of a cell body, which you can see here, a dendrite, which comes off the cell body, and also an axon, which you can see much better here in the normal nerve picture. A neuron typically has one axon, also known as a nerve fiber, that connects to other neurons, muscle cells, and gland cells. And axons are also wrapped in the myelin sheath. So I want you to think of an electric cord with the rubber component being the myelin sheath, and the electrical components on the inside being the axon. So the myelin sheath protects the axon and allows signals so that messages can be transferred back and forth between your brain and the rest of your body. So for example, you touch a hot object on the stove with your hand, a signal from the brain to the body will notify you that you're burning your hand and to release the hot object. So this happens in a very normal central nervous system, or a very healthy central nervous system. Let's go over signs and symptoms. So multiple sclerosis can attack any part of the central nervous system, leading to, you can have visual loss, you can have double vision, decreased sensation, numbness, tingling, pain, muscle weakness, muscle paralysis, spasticity, which is a stiffness or incoordination. You can have balance impairments, vertigo, like dizziness, and fatigue. So fatigue is a very prevalent symptom with MS. There's what we call primary fatigue, which is due to the disease itself. And then there's secondary. So primary fatigue is due to the damage to the myelin sheath and the nerves slowing down signals from brain to muscle cells. And then secondary fatigue is due to you having a sedentary lifestyle, having pain, movement compensation, infection, depression, medication effects, and sleep disorder. How is multiple sclerosis diagnosed? Usually, MRI of the brain is the typical way that it's diagnosed. And that's the purpose of that, is to view any lesions or plaques on the brain. Your doctor will assess your symptoms to determine if you've had an attack at two different areas of the body. So for example, you may develop weakness in one period of time, and then numbness may develop at a separate time. It could be like 6 months apart, along with two lesions on the MRI. So you have to have two different symptoms and then two different lesions to have a definitive diagnosis of MS. Statistics, females, or research reports that MS is seen more in females greater than males at a 2-to-1 ratio. with thoughts that hormonal factors may play a role. Age onset typically occurs at 30 to 35, but I have seen younger clients in their 20s with MS. So it's very, very interesting to see. And it's very uncommon after age 60. Cause of MS, there's really no definitive answer to what causes it. Some research articles report environmental factors may play a role, and also genetics may also play a role. For example, if your sibling has MS, you are at a greater risk for developing it as well. All right. So that was a brief overview of MS. I hope it was straight to the point. Hope it was helpful. And thank you for listening. And please follow me at my YouTube channel at Neuro PT Now Education Series. Thank you.